My name is Dr. Kristen Savage. I'm a pediatrician at Irondequoit Pediatrics. We have patients from the city of Rochester, both East and West Irondequoit, Webster, Greece. I'm also a member of Drug Free Irondequoit. So we know that the frontal lobe of the brain is not fully developed until a person reaches their mid-20s. Just as everybody should know that drinking alcohol affects the developing fetus, drinking alcohol and taking substances also affect the developing brain of the frontal lobe. That's the part of the brain that controls the cognitive function, which is having to do with learning and memory. Teenagers are naturally very curious. They're trying to explore and become independent, and they also naturally lack impulse control. So this is not a good time to introduce alcohol and drugs, because once they try it once, they are going to continue to seek out this stimulation. We also know that sexually active teenagers who indulge in alcohol are much less likely to have safe sex. Alcohol actually can inhibit your immune system, making you more prone to catch sexually transmitted infections. We all know that alcohol can be contributed to alcohol-related deaths through driving drunk. In fact, 72% of adolescent deaths are due to injuries. These injuries are related to motor vehicle accidents, substance abuse, alcohol abuse, and violence with guns, suicide, and other injuries. And only a small amount of adolescent deaths are attributed to medical things like cancer or infections or other diseases. So it is very concerning. And I do see it in my practice. I see a lot of kids are abusing all different things: marijuana, alcohol, vaping, and they have poor performance in school because of it. They're getting in accidents and having injuries. We know that half of sexual assaults are related to alcohol use. And another concerning fact is that 1 in 6 adolescents who abuse alcohol have experienced a blackout in which they can't remember the events of the night before. All of these factors I do see in teens, and it's really important for parents and other people in the community to make sure that they talk to them about the dangers. Parents should start having conversations with their children as early as possible. Starting from a very young age, toddlers are watching everything parents are doing. Parents need to be very good role models and show them things like, if they drink alcohol, they should drink responsibly. They can teach them positive ways to deal with stress that are healthy rather than turning to alcohol. And they should never use drugs around their kids. Kids naturally around the age of 8 to 11 in late elementary school, they love to learn facts and they love to learn about their bodies. So that's a really good time to start having conversations with kids directly about drugs and alcohol and the harmful effects that they could have on their bodies. Let your kids know that you don't tolerate any alcohol use, because it's the law. And when they're 21, they can make their own decision to drink responsibly. Let them also know that drugs are never tolerated. It's important to also talk to your kids about peer pressure. The late elementary years are the time when kids start to become influenced by other kids. Teach them to be independent and teach them to choose friends that have the same values that they have. Encourage their extracurricular activities. It's important for parents of children of all ages to pick up on teaching moments. If you're watching a movie, look for people that are making good choices and people making not so good choices, and point them out to your kids. It really opens the discussion to talk about other things like drugs and alcohol.